Now, in the past 24 to 36 hours, Lagos, Nigeria's commercial capital, has been in the news for all the wrong reasons as a result of the massive breach of social distancing by members of the public following the easing up of the 5-week-old COVID-19 lockdown. Now, Abuja, the country's capital, had been one of the 3 jurisdictions where President Muhammadu Buhari imposed the lockdown order. But in contrast to Lagos, not much has been read into reports of how residents in Abuja have conducted themselves in the wake of the lockdown lifting. Just like experts have been delivering a not-so-encouraging prognosis about Lagos, can Abuja be seen as a calm before the storm? And what must the authorities therefore do to forestall any possible degeneration of the COVID-19 situation there? Now, for a discussion on this, we're now being joined from our Arise Abuja studio by Dr. Abiodun Adeniyi, the Associate Professor and Head of Mass Communication at Baze University Abuja. Welcome to the program, Dr. Adeniyi. Thank you for joining us.
Good morning, Dr. Adeniyi.
Thank you very much.
Great. Good to have you with us this morning.
And Leila, and thanks for having me on.
Yeah, good morning. Well, quickly, the Minister of Health, Osage Hanere, was saying yesterday at the meeting of the Presidential Task Force with members of the House of Representatives that the big problem that we have with the observance of social distancing with the easing of the lockdown in parts of the country is a gross indiscipline on the part of the people. And we have seen reports from Lagos and other parts of the country truly confirming this fact of gross indiscipline and the failure of the people to take responsibility. You live and work in Abuja. Is the situation also in the Federal Capital Territory that bad? Do you see people just willfully defying the guidelines?
Yeah, very well, Doc. It's not really different from what we are seeing or what we've seen in Lagos and Ogun, for instance. You know, yes, Abuja is the capital city, purpose-built capital, a little bit serene. You know, but when we're talking about the serenity of the city, we're probably just talking about the metropolis and not necessarily the downtowns. If you go to the downtown, it still looks as if nothing is amiss. You know, life is still going on normally. You still see people not observing the so-called social distancing or physical distancing, as the case may be. If you see them in the local areas, you know, people are still on bike, you know, some markets even refuse to close. You know, activities are still going. We're still going on normally. You know, and I think this is largely a problem with the kind of messaging presently being deployed, you know, in the administration of communication in this crisis. You know, the messaging still look like it is elite-prone. It is yet to be people-centric. It is yet to be markedly directed, you know, at those who need it most, and which is the mass of the people, those who are the lower rung of the economic ladder. These are people who have suffered long years of immiseration, whose consciousness have been perverted, you know, who value life less than they actually should. So for this kind of people, I think the message, like I've said somewhere else, should actually be a morbid one, you know, one like that will strike them like the pain of the needle, so that their consciousness, their imagination can be captured, and they will realize that death is actually around them, and the only way to prevent death is to obey the advice of our medics, which include, you know, washing our hands regularly, sanitizing, and being physically distant. You know, but physical distancing, I'm afraid, is just a zero kind of exercise that our people, if we want to talk about the level at which our people are subscribing to it. You know, yes, you could say among the elites, to some extent, you know, the message is sinking. Of course, that's very understandable because of their level of consciousness. But for those on the lower rung, I'm afraid, you know, there's still much to be desired. And that's why I think government should concentrate their efforts at the moment. They have done their best. You know, we see their presence every day in the news media. But the media that they are presently concentrated on is the traditional media. And in this time of experiment, the experiment shouldn't just be in the search for vaccine. The experiment should also be in the area of strategic communication. You know, communication should be, you know, should hit the bull's eye, but for now, there's still a deviation. We need to tweak our messaging a little more, make it a little more morbid, strike the imagination of those on the lower rung, those with problematic understanding, those whose consciousness are still very low, and we need to do this so that they can own the campaign, take it very personal, internalize it, and probably act on it, because these people need to be helped to live their lives. They need to be saved from themselves. But as it were, it doesn't appear as if they know, they have a feeling around what is happening. We know that, from the lockdown, like I always say, the blind could see and the deaf could hear. But what about understanding? There's still far. I mean, there's still work to be done in that area. Understanding is still very limited. This is coming upon us probably because of of the preponderance of illiteracy, but we may not be able to address that in the short term. Perhaps we could be talking about that in the long term. But in the short term, we need aggressive strategic messaging, not necessarily directed at the elites through the prism of the traditional media, but directed at those, at the masses, so to say, so that they can come to terms with the proverbial, with the so-called new normal. They can come to terms with the fact that they can also live their life, even if some of them don't value life anymore, having been battered, psychologically by poverty over the years. They find it difficult to create a difference between existing and not existing. And that's the problem we're having, really. And, it can be dealt with through appropriate messaging, Dr. Bati and Leila.
Dr. Adeniyi, thank you for your views on that. And strategic communication certainly is key. I would argue that maybe we are seeing that there is a lack of understanding at all levels of society. Even some of our most elite members of society have shown that they don't necessarily understand the public health policy guidelines that have been put in place to overcome this virus. But I'd like to speak here about population density and the role that it plays in a city like Lagos, the commercial capital, as I said at the start of this conversation. Now, Lagos has a population density that is 5 times higher than that of Abuja. I believe it's 6,871 per square kilometer. This means it is way harder in a city like Lagos to adopt or apply physical distancing measures and actually have them working in the city. So how do you react? Because some analysts feel as though we haven't even seen our spike in COVID-19 yet. Do you feel as though the lockdown that was eased in Lagos maybe came too soon?
Oh yeah, I think if I heard you correctly, I think government probably pandered to the pressure tactics of our economists, public philosophers, public commentators who probably argued, that an African economy, where Nigeria belongs to, cannot survive a long time for too long, and for us to rescue our economy from continuing on a tailspin, we have to get back to work, And of course, we've seen from around the world that this is not peculiar to Nigeria. Even sophisticated countries like the United States, through their president, have been advocating for getting back to work as quickly as possible. So I saw governments, trying to find the balance between enabling the economy to continue to thrive, and ensuring that people are actually alive, to make this economy thrive. So in trying to find the balance, they quickly reverse or ease the lockdown. But I dare say that from what we have heard in history, the last plague that came, the last pandemic that came in the early part of this century, of the previous century, actually came because of the quick need, of the quick desire by authorities not to make it affect the economy. But they reversed the lockdown in the time when they shouldn't have done that. And that's why we had 3 waves of the Spanish flu. From the way we are going, we may also be witnessing it. And of course, reversing the lockdown in our own situation, even in Abuja, was somewhat too early. Because if you see, Abuja may not be comparable to Lagos in terms of numbers, but we are also registering our own increase every day. But again, it's also gratifying to see that sections of Abuja residents are largely compliant, particularly those in the metropolis, are largely compliant with government directive. If you go to supermarkets, if you don't have a mask, you're no longer going to be allowed to enter. And if you insist, of course, a mask is there for you to buy. You also be asked to sanitize, and social distancing, zero compliance. everywhere else, including those supermarkets. But some of these rules have been abided by, which is one of it is mask, sanitizing. We see that happening. But social distancing, I'm afraid, is still zero. So Abuja is relatively peaceful in terms of when you compare it with a place like Lagos and Kano, but the danger still exists, relative to the population of the place, danger still exists more at the downtowns, more in the countrysides. That's where the problem is. The population in Abuja may not be much in the metropolis, but if you go downtowns, if you go to the sites, you will see that it is not too different from what we have in some places like Lagos. If you go to Yanya, for instance, if you go to Karu, if you go to Suleja, which is in Niger State but close to Abuja anyway, if you go to Kubwa, you find out that they live in density, in dense environment that compares favorably with Lagos. So the danger still exists here as much as it does exist in a place like in Kano or in Lagos, which you cited as an example, Leila.
Well, Dr. Adeniyi, before you joined us, we had a conversation with Professor Kemi Rotimi on the role of the police so far in helping to enforce the lockdown. And I would like to have your own take in terms of your assessment of how not just the police, but all the security agencies have conducted, themselves in the course of helping to enforce the lockdown. Because, there have been complaints. We've had a lot of complaints. But Professor Rotimi was quite sympathetic to the police. So I'd like to, get your own view.
Yeah, I don't think the police in Abuja have done badly. But my only regret is that some of those activities, some of those regrettable activities that we do see in the past, is still continuing, even in a time of health crisis like this. You still see some of them deliberately, blocking roads, not to prevent you from moving, but for act for something that we ordinarily know, To that extent, I want to sympathize with the police authorities for not being able to get members of their rank and file, to change their practices, That's what I find very regrettable. But in terms of implementation, do not forget that we also have a joint task force that moves about, and I read reports and I even saw them physically in instances when I was also moving about on account of what I'm probably doing now, and I saw them apprehending people, arresting them and charging them and in some cases convicting them, So the task force was actually very active in restricting movement. And of course, those who were self-respecting avoided coming out even without being told. But this section is also limited to those who have understanding, those who have consciousness, the elites, those who are educated, But for the other set of people in the downtowns, like I keep saying, police never went to those areas, because I don't know where the control will actually start from, because it will have been a Herculean task. But much as you could move around in the countrysides, you could not move around very freely on the Abuja expressways, on the major roads, but the other sides of Abuja were still very, very free, and the police actually police those places less than they should, So overall, you see heavy police presence, significant presence of the task force, but you won't say much was achieved as a result. What I think is important is for us to continue to re-emphasize the importance of values and virtue, the importance of being speak and span in the delivery of service, whether you are in government or out of government. So we see this reflected in police activities, asking for something else other than implementing a government directive. It's a challenge to the police authorities, and we do know that so many reprimands have been made. The only thing I can say in this circumstance is for them to continue, because we find it regrettable, even as an elite driving on the street, rather than they trying to protect you, asking you the right questions.
Well, Dr. Adeniyi,
they would do is to salute you and be asking for what you don't expect them to be asking.
Dr. Adeniyi, well, I see that you are being euphemistic there. You're talking about police trying to extort people, even in the season of COVID-19. Well, we'll take a short break now. When we return, the conversation will continue. Welcome back to the morning show here on Arise News. Well, Leila,
shall I take over?
Engage Dr. Abiodun Adeniyi, Associate Professor and Head of Mass Communication at Baze University, who is still with us in our Abuja studio.
Certainly, Dr. Adeniyi, thank you for staying with us on the program. Now, what we have seen over the past 2 days with the easing of the lockdown in Lagos, Ogun, and the Federal Capital Territory is very simple. And it's that most Nigerians, as you have pointed out, really and truly don't understand the real effects of coronavirus and the importance of following these guidelines. Now, the federal government had warned that if guidelines continue to be flouted, that they would have to or may have to impose another lockdown. But simply put, again, the federal government cannot afford to impose another lockdown, especially not a total nationwide lockdown in Nigeria. We cannot supply the right adequate palliative measures and several other things. We cannot afford it. So is the only option for Nigeria at this point in time really to adopt a silent survival of the fittest approach? Or do you see another way out for Nigeria and countries like Nigeria?
Okay, excellent, Leila. I think what I see is actually a catch-22 situation. I'm trying to find an equilibrium between living our life, and ensuring that our economy thrives. So, again, you can say it's like between the devil and the deep blue sea. But the brilliance of government, the creativity of government can be reflected in how they find this balance. We have seen nations fund this balance, So if other parts of the world have been able to find this balance, it doesn't matter whether they're developed or developing, we can also do it, And one nation that comes to mind is South Korea and Germany to a very large extent, and even Ghana here. And what about South Africa? It's been said largely that testing is a good exercise, really, in the matrix. You test, you trace, you isolate, you treat, and while other sections continue with their life, So if we can, NCDC has promised very impressively that in the next 1 or 2 months, they hope to conduct about 2,000 tests. By the time we begin to ramp up our ability to test, perhaps we'll be able to find this equilibrium, which I think is very, very important. And of course, while we're also trying to improve on our health infrastructure through testing, while we're trying to have more isolation centers, more beds, more hospitals, we need not forget the information aspect of it. Not just ordinary information, not just the creation of awareness, but also trying to get feedback so that the exchanges can become much more conversational, like I tried to allude to earlier on, so that the people can be involved, and in being involved, they can take ownership. And in taking ownership, they will see this thing as personal, having internalized it. We need to get to those stages as quickly as possible. It doesn't matter what you say of President Trump, but what I see going on in the United States now is that the management of the crisis has become very, very conversational, even if they are not being successful, but at least there's an integration of all sections of the populace in terms of how meanings are intermixed, So it's very, very helpful for their system, and they're very hopeful. That's why we keep seeing models all over the place, and it's also increasing their confidence in their ability to manage it. Yes, they may not be successful yet, but in the next couple of months, we'll see success coming up. And of course, we have also seen, example in the United Kingdom as well. Look at their simple messaging. Stay at home, protect the NHS, save lives, straight, simple messaging. I'm afraid we're yet to get to that level. The one I can see so far is wearing a mask, and with every due respect to those who catch that, I don't know what it means. Wearing a mask, so what, So we need to be more detailed, more thorough, more contemplative, and much more reflective, so that we can design perhaps some very original message, that will help in mitigating and interrupting the spread of these things. Finding an equilibrium is not easy, but if we think deep into our resources, into our reserve, it's not something that is beyond us, Leila.
Well, Dr. Adeniyi, in the last week, there has been an emergent controversy around the role of the legislature, particularly the National Assembly, in terms of responses to COVID-19. The House of Reps is considering a bill which it calls the Quarantine Act Repeal and Amendment Bill, or it calls it also Infectious Diseases Bill, or some people refer to it as NCDC Bill. Then the Senate on its part, is also considering what it calls National Health Emergency Bill. And, there are meeting points between the two proposals. But many Nigerians, including the Christian Association of Nigeria, Senator Dino Melaye, and the Conference of Nigerian Political Parties, have questioned the content of the bills as proposed. And their concern is that, look, there are more important things to focus on. And then they've also concluded that, the bills as proposed seem dictatorial, promote the erosion of fundamental human rights, and so on and so forth. Do you think that the critics of these bills, as proposed, are overreacting? Or you think that the National Assembly should focus on more urgent priorities rather than reviewing the Quarantine Act at this moment?
Yes, Doc. I think the National Assembly is probably suffering from, pre-COVID-19 perception of being an arm that is like we probably don't need, if I have to put it that simply. And this thing is coming from the long years of military role. That's why sometimes I want to sympathize with them, really. With the outbreak of this pandemic, I've seen them intervene severally. I've seen them intervene in trying to make the palliatives being administered by the executive to be much more effective, much more productive, and much more realistic, not just a kind of newspaper pronouncement. I've also seen them coming in terms of reversal of the budget or tweaking of the budget, with the passage of the 850 billion naira loan, which was actually moving one head to the other, moving it from the foreign head to a local one. So this is another intervention. And this intervention, to be honest, I won't break any bone out of it. I won't make any serious case out of it because it's the intellectual arm of government, and you do not expect them not to be part of the thinking process. I just see it as an idea, as a proposal, which we go through a lot of vetting, and an idea, a proposal is just what it is, it's still at the level of intellection, it may not even grow beyond that, and passages of bill take processes, first, second, third reading, and don't forget the presidential accents. There are quite a number of bills that are still with the president that he's here to assent to, So this one is also trying to expand, the scope of discussion, on solutions to the pandemic. And do not forget, Dr. Bati, that, earlier on when this pandemic broke out, there were so many conspiracy theories about what did they call it? Is it G5 or something like that? All kinds of shenanigans, all kinds of permutation.
5G.
And before you knew it, it petered out. It died as quickly as it came. And we're now moving into another level now. And, of course, the recrimination or the broadsides over the proposal by the National Assembly is not too far from the conspiratory theory that snowballed that came out in the early stage. So I see these as just a mere idea, which is still open for contestation, for debate, but most importantly, I see it as something that has come to also expand, the opportunities, expand themes, around our intention, around our tendency, our predilections to come to terms, with the reality of COVID-19. No big deal, actually, but I do believe very strongly, Doctor and Leila, that if we have a crisis in our hand, all arms of government will have to be on deck, judiciary, executive, and National Assembly, and I don't see any reason why the National Assembly should be absent at a time like this, just like every other stakeholder as well, including the civil society, including the media, and all other sections of the populace. Dr. and Leila.
Dr. Adeniyi, thank you for your views on that. Let me ask you something. The front page of this day newspapers today, the federal government is considering the review of the 2020 budget of oil price benchmark to $20, says Minister for Finance Zainab Ahmed. How do you react to this? This is the second time now that we are going to be reviewing our budget based on the oil prices. What is your reaction to this?
What has happened to us is actually very unfortunate. Our economy was actually in crisis, an indebted economy earlier on, pre-COVID-19. But now A lot more things are striking on in the face, particularly because we're a monocultural economy, heavily dependent on oil, and of course, oil price, has plunged. So if that has happened, I think it's just realistic. It's just okay for us to get back to the drawing board and see how well we can once again, be creative, be imaginative, and how well we can review things. I don't think the number of times we review it actually matters, but what matters is what comes out of it. But my greater fear really is the way we apply resources in this country, the way we manage resources. Most of the time, when we hear some of these pronouncements, some of these comments by public officials, they look very decent on the surface, but eventually when it comes to implementation, we'll see deviation, which end up affecting, the well-being of the generality of the populace. So what I would just add to that is that while we're trying to do these reviews, I don't have any problem with multiple reviews, but while we're trying to do these reviews, at the end of the day, whatever we have resolved, I want to imagine that it would be in the best interest of the populace, should be followed to the letter. It should be well implemented, not to see further deviation or, in some terrible cases, self-aggrandizement, people seeing some of these opportunities as one more opportunity or one more chance to help themselves, above the populace, above the society.
Dr. Adeniyi, on that note, we'll have to bring this to a close, and thank you very much for always obliging us each time we invite you to join us on the morning show.